guys. Today it's about collagen induction therapy, how to get collagen, how to get a lifting face, what options do you have. I will talk about active ingredients in skincare. I will talk about microneedling radiofrequency, high intense focus ultrasound, fractional lasers, and of course about supplement early. So stay with me, stay tuned if you want to know how things are working and what's right for you to get more collagen in your face. So, hi, my name is Dr. Creamer. I'm back. I'm a board certified dermatologist sitting here in wonderful Zurich, and I'm talking today about my lovely topic, skin, because skin is the dashboard of your longevity funnel and what you can do by yourself and with the trainer, the dermatologist, to enhance your collagen in the face. Let's talk about what actually is collagen, because all my patients get confused and they're thinking something magic. There's no magic, it's science. So you have the upper layer of your skin we call epidermis. I call it cobblestone wall. This is there, nothing goes in, nothing goes out. Fantastic. We're not talking about this for now. Under the cobblestone, there is another layer, dermis and subcutaneous. Let's make it easy. It is a mattress you're sleeping on. And what is mattress about? It's about exactly a spiral. And guess what? A triple helix. Collagen is a triple helix, so it looks like a spiral. And you have the foam. And the foam in reality is your hyaluronic acid and your fat. We're not talking about this today. We're talking now about your collagen, so about your triple helix. So over the years, unfortunately, and this is with UVA in particular, UVA goes deep, hitting the collagen spiral, and that's what? It's get enlarged, and you getting the kind of heaviness down there, and you're feeling, oh my God, I'm getting older, and you're losing this collagen. So you have different things what you can do to kind of not lose your collagen. The super easiest one, I don't even have to draw it. Stop destroying, right? Use a sunscreen, use a UVA, but remember SPF is not UVA, so look on your sunscreen as a UVA protection. So this is number one. Number two is also to enhance collagen production. It's ingredients in skincare, like food acid and like retinol. They are not just doing the cell turnover, working on the upper layer. No, they're also inducing, guess what? The collagen. So it's literally like doing more knitting in your knitting dress. This is what food acid and retinol is doing, and this is what I described in my DrLiv method. So I always tell my patients, without a proper skincare and skincare routine, don't even come to us dermatologists, because it's waste of time and money. So my time, your money. Why? Because a skin is just as good as you prepare, and treatments is just to kind of up-layer it. So let's go next to the treatments. So what treatments do we have? We have microneedling. Microneedling is something super easy. It's a very old method. It actually comes from India. Yes, guys, from India, because a scar, it comes from scar treatment. A scar is either up or down, right? So it's kind of hypertrophic or hypotrophic. However, think about an iceberg and what you do with an iceberg to kind of smoothing out. And this is how does it works. Let me explain it. So you come with a needle deep, right? We call micro needling. This is what it calls. And it has to be in a certain depth. It has to be in a certain kind of layer. And it has to kind of be a very, don't do it by yourself, guys, right? Really, this has to be done, proper done. Otherwise, you get an infection, you get all things, because you're disrupting the barrier. Anyhow, what does the microneedling do? You go deep inside, the skin says, how about the structure? And put you in growth factors, and guess what? New collagen. Check out good new collagen. So this is why it works fantastic against scars, because scars are kind of made of bad collagen. We can do another YouTube about it. But here you're kind of inducing new good collagen, because the skin has time, because you're not hurting. You're just kind of doing an introduction. This is why it's called CIT, collagen injection therapy. Okay, so microneedling. Nice, cute, but I tell my patients, you know what, with food acid retinol, you do the same thing, so no need for an extra stuff. The next way was heat. So the question is how we get heat down there. Think about your kind of cardigan, right? Your kind of knitting dress. If you wash it too hard, what happens? It's shrinking. And this is what you want to do with your collagen. You want to get it tightening, right? And this is what everything on earth in medical, in the devices do for you to kind of get you the tightening. Let's start with something super easy. Let's start with the lasers. So let's prolong a little bit our cobblestone wall, so our webs, just to make it a little bit more easier to you to understand. So a laser. With a laser, we're removing everything. You look horrible, right? This is done like years ago, a CO₂ laser. But then I said, okay, why have to destroy everything? Let's do it in small kind of like beams. So we call a CO₂ fractional laser. So what does it mean? Fractional. So you're kind of making small holes through your cobblestone wall, through your epidermis. The skin says, oh my God, we have to repair, and you make small fractions. Or you really make some kind of holes with the laser. So, but differently to the microneedling, here you're not hurting. Here you just like, this is why you look good after microneedling. With the fractional lasers, you have a downtime about 10 days. You look horrible because you're destroying the upper layer. And the idea is getting heat there to get enough heat to get the tightening, the shrinkage of the collagen. Okay, it's nice. We did it 20 years ago. Cute, right? It's still done. I like it. Yeah, but honestly speaking, there are better things on the market. So let's go further. What came next? HIFU. What the heck is HIFU? HIFU is high intense focus ultrasound. There are a couple of names out there like Whole Therapy and all other brand names. These are brand names, right? However, how does it work? It's like a microwave. So a microwave, where do you get your food first hot? In the deep thing, because the ultrasound goes deep, and heating it up with the idea to get a shrinkage. Nice, but already 10 years ago, we're seeing get a fat atrophy. What does it mean? You don't need to understand medicine, but it's very logic. You go with the HIFU deep, and guess what? You're landing in the fat layers. And if the fat gets heat up, boom, you destroyed. It calls fat atrophy. Not good. So this is why it's not used in the upper layer. If it's used as down there, I personally, opinion, it is a little bit too expensive for what it's for, but has this kind of place in the collagen injection therapies. So then the next point is radiofrequency. Radiofrequency was actually just heat on top, but you have to kind of move, otherwise you burn, right? So you want to get heat down there, doesn't really work nicely. But now comes combining old and new method, right? So combining microneedling with the heat, but not heating and destroying the upper layer, the epidermis, our cobblestone wall. No, you get a heat impulse. So you go with a microneedling in, with a heat impulse down there, and then with the heat, you get a shrinkage of collagen, therefore a tightening. And there's a lot of kind of out there on the Instagram and TikTok is like, oh my God, the microneedling radiofrequency gives me fat atrophy. Yeah, why? Because if you're not doing it wrong, guess what? Everything goes wrong. And if you go, and you don't need to study medicine to understand this, if you go down, you go too deep, because Instagram is about more, bigger, faster. Okay, less is more, guys, you remember. If you go too deep, guess what? You land in the fat. And if you're heating up down there fat, guess what? You get the fat atrophy. So it's not about the depth. It's not deeper is better. It's about the correct depth and the correct way, and less is more approach. Because with microneedling radiofrequency, so as with microneedling, is just you kind of helping to help your skin to produce its own collagen. And it needs time. So please stop doing it 6, 8, 10, 12 per year. Are you all nuts? I tell my patients 3 times max. Why? Because the skin wants to induce. You can 4, but don't overdo it, because your skin needs time to regenerate. This is why it's 4. It is helping to help your skin to generate more collagen and kind of with the heat, a tightening up. And I love it for the neck, right? So home devices are just going superficial, doesn't really do a lot, and I always have to laugh because what you want to induce, hyaluronic acid, vitamin C, doesn't really work. It does it in a proper way and with a proper trained, certified dermatologist or plastic surgeon, but it has to be a certified doctor, right? So therefore, or somebody who really knows how to do it, it has to be kind of sterile, it has to be a numbing cream, because otherwise it does hurt. Another thing what I always see on Instagram is this huge bleeding if people do just microneedling. Let me explain quickly, because it really came into my mind and I would like to talk about it. You remember these kind of pens, right? The pens are going in, out, in, out, in, out. So, and if people, what they're doing, what you see on Instagram, like these moving, okay, I get a heart attack, because think about it. Moving means you are with a needle in and then you must sidewards. Not good. You destroy your upper layer, and this is why you're bleeding like crazy. The needle, if it's a pen, it's a kind of, it goes in and out by itself. You have to go up, move on top, go in, move on top. So not this movement, right? It's really like almost like a stent, not movement. So please don't do crazy stuff. Less is more approach. And the last thing what I always get asked from you guys is about supplement from the inside. Collagen as a supplement. So there is, and you can Google, you can ChatGPT, Harvard study collagen supplements. And it clearly says, which is also my opinion, is there are not sufficient data, and it's kind of pushed by the industry in small study design, and it doesn't show heavy improvement. If you see different kind of collagen things, it is a kind of, you have all the vegan ones that do not work. Or then you have bovine and you have marine. What does it mean? Bovine means from both, so from rind, I don't know the English word for it, and the marine is from smashed shellfishes. Guys, I do a lot for beauty, a lot for health, a lot for longevity, but it will never ever kill animals for beauty. And you have to think about it. If you're taking collagen, if you're taking bovine or marine collagen, you're killing animals for beauty. If you say, oh no, it's just the leftovers, okay, really? Number two, this amount of people, millions of people who buying the expensive collagens, they kind of raising the market, and kind of really the marine collagens, the poor kind of shellfish, the smashed shellfish, they will kind of get kind of feeded and get just kind of pushed for you for the collagen supplement industry, which in my opinion is a no-go. You can enhance much more with other supplements, like get the protein, get the amino acid into it, get the vitamin C to produce collagen, because big collagen molecules, and the gut is also couplosome, will not go through. I like from a colleague, he talked on Instagram, and he said, look, if you want to have eye sides, you don't eat eyes. Same here. If you want to have collagen, you don't eat collagen. It's the same similar comparison. If you want collagen, do your thing correctly. Start with food acid. That's why I also invented my level system. And retinol in the right order. Then go on microneedling radiofrequency, and you get what you want, and less is more. So I hope you got a little bit of an overview. Give me some comments, send me some comments on suggestions, and I will do another YouTube video about it. I will answer all your questions down there. I hope you like it. Share it to a friend, comment down there, subscribe. I'm back. Your DrLiv. Hello from Switzerland. Love you all.